Hi, my name's Ray. Thanks for checking out the channel. So according to a quiz that I posted on my personal Instagram with about 100 responses, the majority of those responses thought women need a pap smear every year. That's not right. And the actual answer is kind of a lot. So let's get into it. I feel like I should first of all talk about what a pap smear is. It is actually a pap test, and it's a collection of cells gathered from the cervix and the vagina during a speculum exam. The reason we perform pap tests is to screen for cervical cancer. Knowing that we use a pap test to rule out cervical cancer, you can kind of see why we start testing at 21 years old. Regardless of sexual history, regardless of if you state sexual abstinence, the testing starts at 21 years old. The risk for cervical cancer in someone less than 21 years old is very rare. They're at very low risk. The women that we do screen with pap test to rule out cervical cancer are considered average risk. They also need to meet the qualifications of being asymptomatic, which means they're not exhibiting any symptoms of cervical cancer, and they need to be immunocompetent, meaning that if they get an infection from something, their body can fight it off. Now, for women aged 21 to less than 31, we recommend testing with just a pap test. If the test is negative, repeat every 3 years. We start testing for HPV in women aged 30 and older because women infected with HPV who are younger than that usually have temporary infections which they can clear on their own. For women aged 30 and older, it gets a little more complicated. These women tend to be at a higher risk of cervical cancer, and we use 4 different options for screening them. First option is co-testing, where you do a pap test and an HPV test repeated every 5 years. Or you could do a primary HPV test every 5 years, or a pap test with a reflex HPV test every 3 years, or a pap test alone every 3 years. I think all of those are pretty much self-explanatory except maybe reflex testing. So what happens is you do a pap test, you investigate those cells. If you see any atypical cells, then you reflexively do an HPV test right then and there on those cells. Now, when do we stop testing? Women who have had adequate screenings and who have had no abnormal results, we stop screening at 65 years old. To wrap up the whole video and to answer the initial question, no, women do not need a pap test every year. Testing depends on age primarily and results from the pap test. Thanks for checking out the video. Please like it if you liked it, dislike it if you disliked it, and subscribe for more content.